Disclaimer: We Level Up is not promoting the use of Benadryl. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss Diphenhydramine Benadryl Overdose Symptoms. Important Diphenhydramine Benadryl Overdose information. An overdose of Benadryl, diphenhydramine, can be very serious and potentially life-threatening. It's important to seek medical attention right away if you suspect an overdose. While few people actually die from a Benadryl overdose, antihistamine overdoses are possible. A Benadryl overdose can cause serious heart rhythm troubles, which can lead to death. Diphenhydramine overdose is due to toxicity from the Benadryl drug. Common signs of diphenhydramine overdose include confusion, hallucinations, delirium, anxiety, intense drowsiness, restlessness, nausea, inability to speak, increased heart rate, and urinary retention. What is Benadryl? Benadryl, diphenhydramine, is a brand name, over-the-counter, OTC, medication classified as an antihistamine. It's used to help relieve symptoms of seasonal allergies such as hay fever, other allergies, and the common cold, as well as itchy skin due to insect bites, hives, and other causes. Diphenhydramine or Benadryl is also most often used for treating vomiting, nausea, allergic rhinitis, mild to severe allergic reactions such as anaphylaxis, and as a mild sleep aid. However, due to easy access to this over-the-counter medication, it is often abused. It can lead to acute intoxication, and if taken in large doses, it can lead to Benadryl overdose. Benadryl is one of the most commonly used over-the-counter antihistamines. It is also used to treat motion sickness, insect bites, and hives. Benadryl comes in many different forms including tablets, capsules, liquids, and topical creams and sprays. According to the National Center for Biotechnology Information, NCBI-3, over the past 20 years or so, the drug misuse scenario has seen the emergence of both prescription drugs abuse and over-the-counter, OTC, medications being reported as ingested for recreational purposes. OTC drugs such as antihistamines, cold and cough medications, and decongestants are reportedly the most popular in being diverted and misused. Benadryl dose. For most cases, the recommended dose of Benadryl is 25 to 50 mg every 4 to 6 hours, not to exceed 300 mg per day. For severe allergies, your doctor might suggest using 50 to 100 mg every 4 to 6 hours, not to exceed 400 mg per day. For children, the recommended dose is based on the child's weight and age. Taking too much Benadryl can be dangerous and even life-threatening. Generally, the recommended amount of Benadryl for adults is 1-2 tablets every 4 to 6 hours as needed for relief. Generally, no more than 6 tablets should be taken in a 24-hour period. Taking more than this recommended dose can cause serious health issues, including seizures, slowed heart rate, and respiratory failure. If you think you have taken too much Benadryl, seek medical help immediately. It's important to always follow the dosing instructions of your doctor or pharmacist when taking Benadryl. Make sure to read the label to determine the correct Benadryl dose and to make sure it is safe for you to take. Before taking any new medications, including Benadryl, you should consult your doctor or pharmacist to ensure the medication is safe for you to use. EMS treatment for Benadryl overdose. Hospital emergency room Benadryl overdose treatments, also known as Benadryl overdose treatment EMS, generally include fluids through a vein, by IV, medications to treat symptoms or reverse the Benadryl overdose effects, activated charcoal, laxative, breathing support, including a tube through the mouth into the lungs and connected to a breathing machine, ventilator. Recovery from diphenhydramine overdose is probable if the patient prevails during the first 24 hours. Difficulties from pneumonia, muscle damage from lying on a hard surface for a long period of time, or brain damage from deficient oxygen can result in permanent injuries. Few people actually die from an antihistamine overdose. However, serious heart rhythm disturbances may occur, which can cause death. Keep Benadryl and all medicines in child-proof packaging out of reach of young children. Benadryl half-life. The half-life of Benadryl, diphenhydramine, is typically between 4 and 8 hours in adults. That means it takes approximately 8 hours for the body to eliminate half of the drug. The half-life of Benadryl can vary depending on characteristics such as age, liver function, and other medicines used. It's important to note that Benadryl's half-life is not the same as its time span of action. Dangers of Benadryl overdose. What is a Benadryl trip like? Due to sensations of profound sleepiness, a Benadryl trip might imitate the high feeling brought on by various recreational drugs. Do not underestimate how dangerous this medication is. Just because it is available without a prescription doesn't mean it can't kill you if you take enough of it. There is a fine line between being a bit sleepy and having significant problems like heart problems and seizures, which can be life-threatening. According to the National Institute for Biotechnology Information, NCBI-4, in 2016, a study demonstrated that diphenhydramine or Benadryl overdoses made up 3.2% of drug overdose deaths in the U.S. in the same survey. Diphenhydramine ranked among the top 15 drugs most frequently involved in drug overdose deaths in the U.S. FDA warns about the Benadryl challenge. A person has reportedly died after taking an excessive amount of Benadryl anti-allergy medication as part of a challenge on the social media app TikTok. The challenge involves TikTok users daring each other to consume large amounts of the medicine, normally taken to ease allergy symptoms from conditions like hay fever. This is not a drug people should be experimenting with. So what does a Benadryl overdose look like? What is important for people aware of this TikTok challenge to know about the medication? The U.S. Food and Drug Administration, FDA, warns that consumption of higher than recommended doses of the popular over-the-counter, OTC, allergy drug diphenhydramine, commonly known as Benadryl abuse, can lead to seizures, serious heart problems, coma, or even death. FDA is aware of news reports of a person ending up in emergency rooms or dying after playing in the Benadryl challenge, encouraged in videos posted on the social media app TikTok. How can you overdose on Benadryl? Diphenhydramine is a type of medication called an antihistamine. It is used in many allergy and sleep medications. An overdose occurs when a person ingests more than the standard recommended dose of this medication. This can be by accident or intentional. The active ingredient in Benadryl called diphenhydramine is harmful when consumed in large amounts. Benadryl addiction treatment. Benadryl abuse and addiction affect not only users physically but psychologically and emotionally as well. In addition, relapse is often possible because of the symptoms associated with antihistamine withdrawal, including those who developed a dependency on this medication. Moreover, people addicted to diphenhydramine often have concomitant addictions to alcohol and other drugs. Hence, asking for expert help in a drug abuse treatment center might be an option that users can consider if they struggle to overcome their substance abuse disorders. The professional guidance and assistance provided in an inpatient setting can offer the client a better understanding of their addiction and help them effectively recover. A tailored program can be developed for a specific person's case. During treatment, the client is also offered several therapies to help them recover control over their lives. These may include psychological therapies, counseling, meetings, support groups for family addicts, individual and group therapies. Suppose you or your loved one is worried that the Benadryl dependency or abuse may lead to a life-threatening overdose Benadryl. In that case, indeed, help is just a phone call away. Professional prescription drug addiction treatment is necessary for fast and effective recovery. Contact us at We Level Up NJ Treatment Facility to learn more. We provide the utmost care with doctors and medical staff available 24/7 for life-changing and lasting recovery. We provide an enhanced opportunity to return to a fulfilling and productive life. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.